Thank you, Sarah. We're back, and I want to welcome Dr. Craig Kinzer. How are you, my dear?
I'm doing great. Thank you for having me.
Oh, you're very welcome, and I want to thank you for Smiles for Kids. I think that is so important, not only health-wise, but self-esteem-wise. It's
Definitely.
great. Tell our viewers about your wonderful program.
Before we start that, did you realize that tooth decay is the #1 disease in children today, and that it's completely preventable?
No.
And that
I wouldn't have thought tooth decay would be.
Tooth decay is the #1 disease. And
Wow.
so just imagine, as a child having pain, discomfort, and or maybe the self-esteem issue of just decayed front teeth and they're
Sure.
not able to smile, how that'll affect them in school and with their friends.
Right.
And so Smiles for Kids, it is a program that's really targeted specifically for kids that are not on Medi-Cal or Denti-Cal and that maybe on the other side of the spectrum have insurance and can afford dental care. So kids that are on either qualifying for lunch programs, WIC and CHDP, what they're able to do is come to our office, and on this day they're going to be screened, and we're going to do exams, x-rays, cleanings, sometimes sealants even, that day. A lot of education. Education is a huge part of this experience too, so we
Great.
can learn about what they can do to prevent the disease, because again, the disease is preventable. And then from that day, each of these kids are going to get adopted. And they're going to either be adopted in our office or in another local office or possibly to Sacramento to have the work that we diagnosed that day done for them.
How wonderful. That's great.
Yeah.
That's very good.
It's exciting. It's fun. It's a
I bet
day,
it's very rewarding for you.
It is. It's a busy day. It's, a lot of kids and great experience. And it's a time not only for the doctors that are working in the office at that day. We have local doctors donating their time. We have the doctors in our practice, and then we even have a doctor coming from El Dorado County that's coming and helping us for the day.
Good.
But then also our staff, and then other local assistants and hygienists that are coming to our office that day to help us out. We'll have as many, I think about 10 or 11 providers in 17 different operatories, and it's a party.
Now I remember last year you had a lot of kids coming in.
We do. We've had as many as close to 100 kids coming through on that day, and it's fun. What we're doing now, just to kind of try to make the flow better, is we're setting it up so you can call our office starting now to actually make an appointment. So we'll schedule a time where you'll come in, and what we're doing is we're scheduling appointments from 8 to noon between that period of time, and then you come in with your child. Very, very important that the guardian or parent comes with the child, because a lot of it's education, so we're not going to educate just the child, but we want to educate the parents too on diet, how to take care of their teeth, and all the care that this child may need.
Right, or else you'll end up putting teeth in the cup like your parents.
Well, yeah, hopefully not. That's what
like
we don't want to avoid that. Well, we don't want to do that.
No, you don't want to do that is right. How young should a child be when they start brushing and really a parent start worrying about their dental care?
Even before the teeth are erupting through the tissue, through the gums, at age 6 months or less, you can be using a sponge or a washcloth. There's little baby finger cots you can put on. As the teeth start to erupt, it's good to start brushing your kids' teeth right away. Want to be careful with them so they're not running around with a toothbrush, so they'll fall in on that toothbrush.
Well, I remember in my day, even our parents used to do this. They used to just take a cold wash rag, put it in the freezer, and give it to the baby when they were teething, and just rub. They would rub, and you know.
I mean, the teeth are coming through. They want to bite on something and feel comfortable with that. You want them to feel what it feels like to brush their teeth really well, not to make it as a foreign thing.
Right, and today with all the good tasting toothpaste out there, why not?
Yeah, toothpaste. It's a good and a bad thing. Sometimes it foams up and we can't see what we're doing. And so we want to be careful with that. And then some of the kids are too strong for them. They'll notice that they don't like that. And it's not the toothpaste. There's fluoride in the toothpaste, but what really cleans the teeth is the mechanical agitation of that brush. And
okay.
So good technique is good.
So you should teach kids to brush at least 2 minutes?
2 minutes is good.
Okay.
Yeah,
2
definitely.
minutes.
And you get a little timer is good. A little egg timer on the counter.
Yeah. Make it fun.
Yeah, I know. And make sure they're being effective. You want to watch them. What I'll do is when I have a patient that hasn't been educated real well, I like to see them brush their teeth and see how they brush. for that day too. So so in the program again, so that day we're going to be taking x-rays on them. We have returning patients that come through. We do follow-up exams on them.
Oh, that's great.
And we're probably not going to do any fillings that day or procedures because we have so many kids, but the good thing is
That's when you adopt them out to
we're
have
going to have
them
the
done
treatment plans written up that day for them.
Great.
And it's important to realize that this is done at no charge to the patient or parents.
And the ages between 2 and 18?
2 and 18, also residents of Amador County.
Okay.
And we feel bad because I know some Calaveras counties or other counties want to come to the program. Those counties do have programs similar to this that are available. But
Okay.
they have to be residents of Amador County. They need to have a guardian with them. Again, reduced and free lunch program is a good qualification for it, and make it into our office.
I think that's
And again, make
wonderful.
sure and call.
You have to call and make an appointment. Right.
You're going to put our number up, 209-223-2712.
Okay.
And I'm sure, again, Jackson Creek Dental Group when you're trying to get hold of us.
Great, and I think that's very important for anyone out there, and especially there's a lot of grandparents raising their grandkids.
Great,
And they
yeah.
and a lot of times that's in the back of their. It's not important. Okay, people
Sure.
don't think about that, and children should see their dentist at least twice a year.
Things can happen really quickly in the mouth, and
Right.
so particularly on kids' teeth, they're a little bit smaller, so decay can
happen
get through the
faster.
tooth faster, end up with a toothache a lot faster.
Right.
Realize that a lot of people think, oh, they're just baby teeth, we're going to lose them, we're going to get adult teeth. These baby teeth are the foundation, and they're holding space for the adult tooth to come in. Also, there is your mouth is alive, and there's bacteria living in there. And the bacteria that causes decay is not what we want in the mouth. So if you have a lot of decayed teeth around teeth that are healthy, that are erupting through, that decay is going to affect those teeth. So we treat it as a disease, and so we need to clean up the decay as best we can, and then have proper diet and education and cleaning of those teeth.
Now, is it good to tell kids, because I know that sometimes after lunch they can't brush their teeth, they're at school or whatever, just to go and rinse their mouth out with cold water?
Rinsing's good. Sugarless gum is good. It does reduce the acids in our mouth, and that's probably the best thing that you can do is have a sugarless gum. I know in school we're careful about letting kids chew gum, and then the gum ends up under the desk, but there's a benefit to it. And you only need to chew the gum for 10-15 minutes and then throw it away.
Okay.
Particularly gum that contains xylitol. It's a very
Okay.
effective gum by a company called Spry, and there's different companies out there.
Good. So give us the dates again.
So the date, it's February 1st, okay,
Right
at
around the
Jackson
corner.
Creek Dental Group. The number to call is 209-223-2712, and you'll talk to our group there, our team, and they'll help schedule you, tell them you're interested in Smiles for Kids, and it's a great day. Again, it's going to be, kids that live in Amador County,
And you have to have a guardian.
a guardian with you, ages 2 to 18. Unfortunately, this is not for adults on this particular occasion, and yeah, we'd love to see them.
I think that's great, and I thank you very much, and all of the dentists that are involved and your staff, because it's very important.
Everybody's there on their own time, helping donate and
Great.
being part of this to help us, because we can't do it alone.
No, of course
I need
not.
a team to be able to
Of course
accomplish
not.
this for them.
That's great. Well, I want you to come back and update us on how everything went.
I sure will.
Because I think that it's really important, and keep brushing out there. With that, we're going to go over to Cam, and I believe we're going to do a roam with him. So we'll see you in a second.
Check out our new website upgrade,